Are you going to the Therapy Expo? If you are, I want to see you. We are going to be there on a stand, a bigger stand than we've taken ever before. I've got loads of my team going down. I am presenting twice on the Wednesday on the STA stand. So make sure that you come and listen to my talks. They're going to be fun, full of energy, and lots of great takeaways. And then we are going to be running short coaching sessions all day Wednesday and all day Thursday completely for free. And you get access one-on-one to me and my team. So here's what you need to do. If you're coming to Therapy Expo and you want to plan your day out and you want to get in early, because last year we ran out of slots very quickly. In fact, we ran out of slots by the beginning of the first morning of the first day. All the slots had been taken for coaching. So I've got double the amount of team coming this time, and we want to be able to support you. So if you want to plan your day, head to the link in the show notes where you can book your coaching session in now. It's completely free. There is no obligation. We are just there to talk to you about whatever your biggest challenge is right now in your business. Is it your pricing? Is it your packaging? Is it your marketing? Is it your sales strategy? Lo and behold, you do have one of those. You just probably don't know about it. Have you got some leaks in that funnel or in that bucket of yours? Are you struggling to hire A players? Do you not know what you're doing when it comes to leadership? Is your mindset holding you back? You have mindset coaches there. You have strategic coaches there. You have coaches there that are running and have run multiple six-figure businesses, and we are here to support you. So I'd love to see you at Therapy Expo. Even if you just want to come over and have a chat with me, please do head to the stand, and we look forward to meeting you on the day. Welcome to the Treat Your Business podcast, the show for clinic owners who want real, honest advice and tried and tested ways of doing things. I'm Katie Bell, and this is the new era of bigger insights and bolder conversations to help you grow a clinic and a life you love. Let's dive in. Hi, ladies. Welcome to the Treat Your Business podcast.
Thank you very much for having us.
No, thank you.
You are welcome. Please dive in and tell our listeners who you are and give them something exciting that they're going to learn from this episode today.
Sure, I'll start, Anna, because I want to introduce you. So I am Liz Clare, Managing Director of MBST UK, which is now MBST Health. We provide MBST devices to the UK. We have now taken on the commercial aspects for MBST for across the world. And right now I'm in Riyadh in Saudi Arabia, which is really exciting as we're growing more and more across the world as MBST is becoming more and more known and useful, especially within sport and physiotherapy. So today I'm really excited to bring on Anna to meet you all. Anna is our Chief Medical Officer at MBST Global. So it's great to have her here with us. And Anna, I'd like to introduce you as a very strong woman in the medical field. I think you should talk about your profile. There's no one better to be able to do it than you. But thank you for joining us today.
Thank you very much for the invitation and the very nice introduction. Thank you very much, Liz. I really appreciate working together with such cool people all over the world and in the UK. Mainly, my background is that I'm a board-certified orthopedic and trauma surgeon and sports medicine specialist. I'm still a university lecturer at the University of Tübingen, Germany. I'm located in Munich right now. I'm still involved in research with a clinical focus on joint preservation and magnetic resonance-based regeneration, frequent speaker on nuclear magnetic resonance therapy, but also MSK, combination therapy, physical therapies, also diving into clinical quantum biology aspects, and advise also our other stakeholders and collaboration partners. And at MedTech or MBST, I'm their Chief Medical Officer at MBST Global, and try to bridge cutting-edge science and clinical practice, bringing together many people who are interested in the field, trying to solve the problem of making complex issues understandable, and also advocating for a modern approach to medicine and therapy. And I think today people will learn about a very unique and specific modality and why actually health starts in the cell and why we could offer something that helps bridging a treatment gap, which many healthcare practitioners still perceive, even though nowadays we live in a very modern society, which already has brought up fascinating technologies and good treatment options.
Welcome to you both. Thank you. I'm really excited to be hosting this episode. Anna, Liz, for listeners who maybe have never heard of MBST, because we're here to raise your profile and improve visibility. Could you describe it, like, if this is possible, at a really high level? What is MBST?
Okay, so actually MBST is a unique device or modality which complements physiotherapy, rehabilitation, etc., as part of combination therapy by helping restore normal, healthy self-function from within. And unlike many approaches that mask symptoms, MBST works at a very molecular and cellular level to stimulate the body's inherent natural repair processes, calming inflammation and supporting long-term recovery. And it's based on scientific precision and evidence-based. Yeah, it's working directly on cellular quantum mechanisms offering a non-invasive drug-free solution, which is designed to complement additional therapies and also promote sustainable healing. So in the end, it helps patients to move better, recover faster, and live with less pain.
What a fabulous answer. Fabulous.
Well, I left Anna to answer it first of all from that point of view of, and I guess my background is 14 years ago, opened the first ever physiotherapy MBST clinic in the UK. And back then there was nobody else providing MBST. And people would say, what is this spaceship that you brought into the clinic and things like this? And back then we don't know what we know now. And last year that the cell study that came out has changed everything, because we know exactly what's happening at cell level. Now, I say we know exactly, the scientists know exactly, the quantum physicists know exactly. And for the past 14 years, we have grown organically, and there's now 18 medical practices within the UK that use MBST, and that has been down to patient results and healthcare professionals just like yourselves that have taken on the MBST device to provide it to their patients. And we've got 4 full-time sports clubs now also. So what is MBST? It's a modality that is now being introduced more and more into medical practices in order to give patients an additional option, and that it's non-invasive. There's been no known side effects since 1998 when it first came to market. And what is so great, it is the MSK specialist that can offer it. Our physiotherapists, our osteopaths, our chiropractors, orthopedic consultants can use it for those cases that is early on. So what MBST is, not just an amazing science, not an amazing technology, but it really is a highly successful outcome for the patient.
And what I also like to speak about is one of our, let's say, sports club collaboration partners, Wrexham. They have the same, let's say, background story like we do. It's some kind of, we've been some kind of an underdog for a very long time. So when I still worked at the hospital, I was not aware of those modern, innovative physical therapy modalities like shockwave treatment, laser therapy, and MBST is something unique within those kind of modern approaches to how healing can be stimulated. And which fascinated me was like this amazing cell studies, like even I myself as a doctor learned so much about where health actually origins, and that is the cell. And that if you want to address that properly, you have to try to stimulate those kind of processes in a physiological manner. It's very different comparing to the approach of pharmacology or even surgery. Once you understand that kind of approach, it makes sense why actually this kind of therapy should be considered part of modern combination therapy, modern medicine. Yet there's some older clinical data, there's lots of clinical experience. So all this kind of combination was quite fascinating to me. But yet it has been an underdog, like Liz said, for a very long time. And it's funny because one of our sports clubs, like Wrexham AFC, we are collaborating with, they've experienced a similar story, like from their sports point of view. Yeah, we seem to be good partners for also those kind of, let's say, entities. And now it's very good to see that we can spread the word more and more about MBST, learning more about their quantum physical background, but also learning from our latest clinical evidence combined with this kind of latest cutting edge research. So this is, I think, a very special combination not every kind of modality can offer.
So, Annie, you briefly mentioned there, what I think you answered my next 2 questions, which was, what is the mission of MBST? And also then who it benefits, really. And you've made references there to sports players, to the young, to the old. It feels like, and maybe it's just because I'm now involved with you, Liz, over the last few months, but it feels like MBST UK, now MBST Health, is really going a lot bigger this year. I feel like you're really going for it. What is the mission behind this? What is driving this?
Actually, to make that kind of treatment accessible for everyone. So like for younger patients, for older patients, for, let's say, professional athletes, but also recreational athletes, to support, let's say, existing standard therapy protocols, but also offer a unique add-on which could close a certain treatment gap that still exists. But I think from medical perspective, it's also about trailblazing a new understanding of, like this kind of whole person health concept, this kind of holistic approach can look like. And regardless of MBST, physical modalities like weak magnetic fields, like quantum biologist researchers are quite well connected within this group of quantum biologists all over the world. And like scientists are more and more interested in those kind of physical approaches to maintaining or sustaining health or restoring health, like those low or weak magnetic fields. And MBST is a very special thing within this kind of, let's say, modern or innovative approach to health and medicine. And we want to make it accessible in the future to everyone. And we just recently partnered with the University of East London. They opened Enabled Health Hub. So this is actually a very good, let's say, first example, first chance for us to not only cover, let's say, university research and studies, but make this kind of treatment accessible for the very neighborhood, tackling major health issues like osteoporosis, osteoarthritis, back pain, all those kind of health burdens which really affect also society with a socioeconomic impact.
Yes.
But doing studies, but also like helping the very patients in the neighborhood and raising awareness for, let's say, those health problems, but also modern innovative approaches to tackle those.
And does MBST sit alongside other modalities that we're aware of? How do you see this as, I always say as physios when we qualify, we have all of these tools in our toolbox. Is MBST one of those tools? And does it sit alongside shockwave or the radio frequency modalities that we might use?
I love that you just talked about that toolbox, because during my lectures or when I explain combination therapy and physical therapies to my colleagues or other audiences, I always come up with that kind of analogy. And as an orthopedic surgeon, we obviously think in those kind of analogies, like I've worked for a long time with like specific toolboxes. Absolutely. Like I think modern medicine will be individualized, will be more personalized. We will have to see which tools exactly fit perfectly to patients' expectations, but also their very indications. And so, yes, many of our experts already use MBST as part of this combination therapy. And interestingly, they often notice that even though they have been using shockwave, for example, or laser therapy for a longer time, they have better results in combination with MBST, especially our experts who do shockwave therapy. They say, I can produce even better, let's say, shockwave results if I combine this kind of thing. And the specific thing about MBST that you can address indications tissue specific. So those other kind of modalities address, let's say, inflammation processes in a more general manner, but we can go like from just small joint areas up to the whole body. And the very good thing actually that it is non-invasive and pain-free. So in patients where you can't start with shockwave because it might be hurtful in tendinopathies, for example. Or we have a case with even a young boy who did not tolerate any kind of, let's say, therapy. You can start with MBST because it's pain-free, it doesn't hurt, it's non-invasive. You can pave the way for additional therapies. It's absolutely a great fit and a great partner for those other kind of modalities. And speaking of our sports club corporations, we are now about to publish our first case series in professional football. And there we actually demonstrate was MBST, let's say, is it feasible to incorporate MBST into a standard of care protocol? And we could demonstrate exactly that, and that it was really well accepted by the players, that it can be easily integrated into a standard of care protocol, that the players benefit from it. Absolutely. It's a great partner.
And what does a typical kind of treatment protocol look like, Hannah, if you were, say you've got a patient with osteoarthritis? What would a typical treatment protocol look like?
With regards to MBST, we have got different devices depending on if it's just a small OA area or let's say several joints might be affected. You choose the device accordingly. Then the specific tissue-specific software is programmed on specific chip cards. So they actually run the devices. A therapy session lasts for 1 hour. And depending on the protocol, it's 7 to 10, let's say, treatment episodes in a row. So speaking for MBST, but then, as I said, combination therapy comprises more. It's also about adding specific exercise protocols. Every patient has to move properly, needs physiotherapy. You have to also regard the nutritionals that is, so that they also do an anti-inflammatory diet, of course. And then think about, do you have to add any other kind of treatment modalities? Also considering what patient's expectations are, what his or her, let's say, activity level is. And also it's always about speaking honestly to the patient about his anticipations. How severe is the OA? Are we still in the early process where we can, let's say, expect faster results compared to a very severe status where we might think about a knee replacement in the near future? It's also about managing patient expectations. But and regarding in which part of the process the patient is, but MBST might be a very helpful partner within that.
So we've heard a little bit about the story of MBST, and we've touched upon the science because we know that could be a year's worth of episodes, I know, if we talked about the science behind it all.
Absolutely.
But if we just touch on the business side of it, because obviously our listeners are clinic owners, and I think one of their big questions is going to be, like, what makes this a really attractive addition to their clinics? Like, why would they consider MBST over perhaps investing in something else?
I'll probably start answering this question, then Anna can do it from a medical point of view. So, so we've got 18 clinics currently in the UK, and we've never actually actively had a salesperson to go around these clinics and sell MBST. As I said, it's that organically. And I always, whenever I talk to my partners, say, why did you decide to take on MBST? Or even my mother, who was the first physio ever to work with MBST. And she just said, it offers my patients something so much more than I could ever give them before. And when, say, physio 2, 3, 4 that got involved in the early days, he was like, I was seeing my patients come back to me in a way that I've never seen anything else be able to impact anybody. So in order to be able to give a patient results that are more than they could physically give themselves, but also be able to keep them as their patients, massively stands out. The fact that they can see another patient while someone is having the MBST, and their reception staff can be trained quite simply as technicians. Like, these machines have been made so incredibly, and this is why the treatment cards are so important. That holds the software, so you just put that into the machine, which look pretty awesome. They're good looking machine. Put them in the machine, press start. You don't even have to, as long as it's got good bedside manner, you don't have to worry about the actual treatment process. So yes, it is an additional income, and quite significantly. I'll never forget Ian Andrews, and I know that he's been doing 2 of our physiotherapists that work with MBST are going to be on another podcast with you, because I thought it'd be great to hear from them.
Yeah.
And he bought his first MBST device, and the second one within 4 months he bought in cash. And they're not cheap machines, and you do have to buy the treatment card separately. But with that, it's not just about you have this machine. It's about how we help you to be busy. There's an incredible community now of healthcare professionals, nearly 100 from across the world. They vary, don't they, Anna? And orthopedic consultants like yourself, physios that are specialists within nerves in Italy, and everyone gets together, and there's this passion and this movement that still feels. And yes, it does still feel like the early days, not like it did 14 years ago when it was just me, Mum and Charlie in this clinic wondering where our patients are. It's now established, and so people come in now with confidence. There is other healthcare professionals that can help support you. We just had one of our physios that used to work with MBST in Spain. I actually met him when we presented to Manchester City years ago, and there was just this angel in the presentation room that was a physio that happened to work with MBST in Spain. Now he's joined us on more day to day, as he's sitting and spending time with each clinic when they start, so they know how to diagnose, which treatment card, how to manage patient expectations. We don't just provide a device, we provide this in addition. You're joining our family, and let's get these people better with this amazing technology. And we did a survey last year, 2024, 90% were happy with their result. You don't get that in healthcare. The process, the outcome, and that's after 6 months, after a year, it's sustainable.
Yeah, I think, like Liz said, it's fascinating to see this passion for and about MBST all over the world. Like, regardless if you ask practitioners in Dubai, Spain, the UK, Germany, the Asian region. So that's quite good. And speaking of the devices, they actually really look cool. I always speak of some kind of Star Trek modern devices, though, like how you would imagine will medicine look like in the future. You probably would imagine those kind of that devices might be look like MBST devices. But like, yeah, speaking from a medical standpoint or perspective, I've been mentioning the certain treatment gap before. And even though I was working at a university hospital and I've seen modern approaches, even surgical approaches to medicine, but there was still this certain treatment gap. And even though we've already got a very good toolbox and good options, modalities, etc., there's still this kind of missing piece where you somehow can overbridge that kind when it comes to not only patient expectations, but also a real gap, because like many modalities might be more superficial ones, others just address like symptoms, but having something which goes to the very root cause, or which can help with, let's say, general processes, part of every cell and part of every human body. So speaking from a medical standpoint, it absolutely makes sense to consider this kind of therapy modality or device. And we have several patients who have experienced that, like in more chronic conditions. They said, I tried this and that, but something helped a little, something more, but there was still somehow a missing piece. And there are several examples where they said, okay, thanks to this kind of magnetic resonance therapy, I've now experienced real benefit. And let's say my symptoms got less or even fully disappeared. I think it can be a game changer if you are already experienced with something, but feel like, oh, there's something missing. It's a beneficial add-on also from a medical perspective, because as I said before, compared to other even physical therapies or devices, it's pain-free, non-invasive. You can just put the patient on the bed, so it's not some kind of an active thing. It's not that kind of physically demanding or challenging, like doing exercises or performing like manual physiotherapy with your hands. So I think that is an important aspect as well. And I think nowadays it's always nice to have something which distinguishes you or sets you apart, like from other clinics or whatsoever, to have something special, to have something innovative, modern, which even, let's say, reaches to the field of quantum physics. And I think nowadays patients are better informed, and they also want to have cutting edge science treatment available, or let's say see that their practitioners also, let's say, evolve and learn and add new things which might be helpful. Yeah, and it's an additional tool that might not be the very best option for everyone, but for I think a majority of patients.
A large majority. We talk about osteoarthritis and sports injuries, but in the most recent year, and Anna, you're speaking about this, presenting at Therapy Expo about MBST and bone health. And historically, physios might get the odd osteoporosis patient just in to help them be, but now, since we've been focusing, we're actually showing, and what's so great about osteoporosis, we can show black and white the increase of BMD, the fragility scores improving just within weeks. And it's getting another group of patients into MBST clinics, because typically you wouldn't really see many osteoporosis patients. So it's so great to be, and there is no treatment for osteoporosis. This is why I'm in Saudi Arabia. It's because osteoporosis is so huge here, and it's the only outcome. So this is why countries are calling for it, because it's relatively quite fast, the results as well. I met a lady she came to Saudi yesterday from Qatar, and she was saying, I cannot get over how my osteoporosis has got better. And I can see it in the scans. I can see it. I feel it. And it does stand out.
Yeah. Fascinating. If you're a clinic owner, and the 18 clinics that you work with in the UK, what kind of pricing models do you tend to see in clinics that work really well when they're incorporating something like MBST into perhaps their treatment or the way that they work?
Sure. So typically, let's say the rest of the country, but apart from London, you would charge anything between £1,500 to £1,700 for a full course of MBST, an assessment and 2 aftercare sessions. And we normally say do them at 3 weeks, 10 weeks. and then call them, see how they are in 6 months. So yeah, it's that amount for the patient, which I think is relatively not too expensive. You know, people are willing to pay it when they get there. It's hard to be objective. It's objective on that, isn't it? And I always say to clinics, always have that conversation about price before the patient comes in. When people are applying about MBST, I create these talk sheets for the reception staff to say, this is how you then get back to the patient. So the physio doesn't have to worry about, because that is an upsell. That is so much more than a typical physiotherapy, but then you're giving that patient so much more. We do find with osteoporosis, when we're doing that treatment as the full bed, the prices are a bit higher. But with that, we throw in, I don't know, Ecolite, the REMS scan as well. So we'll do, and that keep over a 1.5 year period, they'll keep having consistent scans. So it's probably less physiotherapy unless they need it, but there'll be the scan before the MBST for 10 days. Then it'll be your scans throughout that year just to show the improvement. So we have different packages, and we can only recommend the price. And I say like London's a bit more expensive because London tends to be. But we've got clinics in Bournemouth, for example, that are mainly focused on osteoarthritis. So they will, on top of that, do a whole physiotherapy course for the whole year on top of that, which I actually think you do know the physio that I'm talking about. So yeah, so there's so many different models. So how it can fit in, it's an add-on, but it works.
And therefore, if you're thinking about your return on investment or your payback period, when you're typically charging...
Okay, so I see what you mean for the machines. So the machines are about 100,000 plus VAT, and we do have some brokers that we recommend, not necessarily recommend, that we've worked with before that other healthcare professionals have got on well with. And we normally say if you're seeing 3 patients a month, that should not, you'll start being profit from then paying off that device within the term. If you're seeing 3 patients a month, I will be in there and doing your whole marketing campaign for you. So we don't like to let anyone not be seeing too many patients a month. On average, it'll be a nice, comfortable clinic seeing about 15, 16 patients a month.
And so therefore, when you might take on a device, you also get training, you also get marketing advice in terms of how you can optimize.
Yes, the community, you're handheld quite a bit until you feel... I always think it's one of those things like learning to drive. You don't really learn until you start using it. There is the initial training, then there's the installer devices, training staff and everyone how to use it. Then a few weeks later, we then come in, because that's when all the real questions, and then you've got patients asking the questions. And we do like everybody to be a part of that. It's not just the medical professionals, it's everybody, front of house staff, because they're the ones that are having to deal with a lot of the questions. So it's all your marketing material, research and development. So that is a big part of why there's a treatment card cost, because that goes in the research development, and we're constantly researching, developing. It's so exciting what's happening. And the sports clubs, and I've even had Johnny Nelson has been an ambassador of ours in the past, and I've had a new clinic start, and they had a new receptionist start, and she loved I know you said rugby then, she loved boxing. So Johnny did her a welcome to the team for an MBST. So it really is a wonderful, fun family. And we have we try and do a event every year where we get everybody together socially, but also there is so much data, there is so much new science coming out, that so everyone always has got that support. And I like to say we have a real good group, and you will be in James in a few weeks on the next podcast and I think just listen to them, and I think they realise how great
really hear their experience as well.
And they've been there from when there was only 4 or 5. I think James was the 3rd ever healthcare professional, and then I think Ian was the 4th. So they have really good stories.
I'm excited for that. And Anna, could you bust a myth? Is there anything that you commonly hear that you think, that's that question again, or that's that assumption that some people out there have about these sorts of devices? Is there anything that you can just tell us on this episode that would really help clinic owners feel informed about a decision that they're potentially going to make?
I think there actually come two myths, let's say 2 points of discussion are usually raised. So one is you can't see or feel or hear anything. Does it do anything? So I just see the device. So I think that is one point that is raised from time to time. And there are already magnetic field therapy devices out there. So why what's this got to do with that first thing, getting to this point of you can see, feel, or hear anything? That's actually the very big advantage of this modality, as I was pointing out, because there are many conditions where patients actually already suffer from a painful condition. So having got a tool in your toolbox that is non-invasive and pain-free is actually quite helpful. And you can compare this to imaging in medicine. When you do X-ray or even MRI imaging, you do not feel, let's say, the radiation, or let's say the process which is going on when magnetic resonance conditions are created within your body. Yes, MRI machines are quite loud, but with the MBST devices, they were actually designed in a way they are not loud and not disturbing the patient. They actually could be louder, but they managed to adjust this level, what you hear, to a level where it does not interfere with the patient's well-being.
You can only hear it if you've got your headphones in.
So actually, when you speak to a patient, you can always say, you don't feel anything when you're getting your X-ray, or let's say also other kind of, let's say, specific treatment modalities. So that always helps, I think. And this MRI analogy, for example, also helps when you say you target different tissues. So when you look at an MRI imaging or picture or whatsoever, you see those different shades of gray. So you see the tissues actually are different. And so it makes sense to address different tissues in a specific manner. So I think that kind of picture or analogy helps. So that is about this. You can feel, hear, or see anything. And if you ask the patient, so what do you prefer? Is it like invasive, painful? Is that what modern medicine shall look like? Or non-invasive, pain-free, and like acting on a level which is more profound? So I think asking the right questions back might also be helpful when it comes to those kind of questions. And it's usually people are cautious when they are not used to something, or if they learn about something new. And we doctors are trained like that. That's what we learned at university. And like new things are like, ooh, cautious. Is there enough data available also? That is one thing. And when it comes to other magnetic field therapies, we always love to speak about those as MBST's little brother, because they show promising and good results, and they do a good job. But magnetic field therapies itself is a very broad field. So there's static pulsating fields, high and low frequency magnetic field therapy. So it's not this one and only magnetic field therapy. And usually people somehow associate MBST with magnetic field therapy, but it's something unique. And because it combines different magnetic fields and specific radio frequencies. And our researchers in the past tried to dive into that very topic and separated those aspects and try to figure out, is it like magnetic field or a radio frequency, or the combination? And two separate and different group of researchers could actually show that it's a very combination that creates those unique effects. You can, yes, consider being part of the big magnetic field therapy family, but it's something different and it's unique. So I think that also helps when you are referring to that magnetic field discussion, and that it's actually like also addressing the full body. So regular magnetic field devices can address like single joints or smaller areas. And the thing with it, which is also different for MBSTs, that it can be more tissue specific.
Yeah.
And the other therapies are usually like more addressing inflammation in a more general way. I think that would be the probably most important myth
Great.
I usually try to address.
So Anna and Liz, we've got two opportunities for our listeners to come and chat to you in the next month. In fact, we are all going to be at Therapy Expo. You're there. We are there as well. So we are really encouraging listeners to come and have a chat with you on stand whilst you're there and explore the science and the business side of it and all of the questions that this episode might bring up for people. And you're also going to be at our final strategy day of the year. So if you are a Thrive member listening to this, and perhaps you are a non-member and are considering coming into one of the very small places we've made available for people who are not part of our community yet, but want to come and really explore what we do, you're going to be there on the day so they can have a conversation with you, networking in our break times, our lunch times, etc., and find out a little bit more. And then you've got these Instagram handles, there's ways that they can reach out to you, isn't that, Anna, that we will make sure we pop on the show notes so that people can connect with you.
Absolutely. Feel free to connect on LinkedIn, through our social media, in Birmingham at Therapy Expo. And as Liz pointed out, special emphasis at Therapy Expo will be bone health. I'll be not only talking about MBST, but also REMS technology and options like streamer bones. So bone health is very important, is a very important topic for MBST as well. So yeah, this will be the main focus, but we will have a booth as well. So feel free to come and join us, not only for the lecture, but we're happy to talk to everyone at Therapy Expo at your event. And yeah, feel free to reach out in every way possible.
Thank you. Fabulous. Ladies, it has been an absolute delight talking to you both. I've learned a lot. I know our listeners will have done the same. And I look forward to seeing you in Birmingham and then in Coventry.
Can't wait.
Work together for 3 whole days.
Yeah, amazing. Yeah. And on our booth is healthcare professionals, or myself and Charlie, just whoever you ask. You've got good people to talk to. So yeah, we will be there for both days.
Fabulous.
And I can't wait to come back to Thrive, because I've missed the laugh and the energy in the room. Honestly, what you create, it's amazing. It's such a great day.
I look forward to welcoming you both in just a few weeks.
Yeah, see you then.
Thank you, ladies. Thanks for listening to the Treat Your Business podcast. Hit subscribe now and keep joining me for bigger insights, bolder conversations to help you build a clinic and a life you love.